My slides there, go down a couple more. There you are. So what does this mean? Payers are going to continue to focus on the efficiencies in the system. They're going to continue to look for ways to get money. There's about 23% of the total drug bill in Ontario that's spent on distribution. So the Ontario system's looking at saying, is that an efficient spend of money? Should we be looking at finding ways to save money in that 23%? It's questionable whether that's right or wrong, whether that's enough money. Some will argue that that's not enough money in that distribution system. Some will argue that that's too much. But I think the point I'm trying to make here is that will continue to focus. The public payers will continue to look at ways at saving money, be it Ontario, be it Alberta, be it BC. They're continuously looking at the money and the dollars that is being spent. So that's going to drive change. What else is going to drive change? Well, what else is going to drive change is there's going to be shifts that are going to be adjusted for the economic model, because in essence, how is it going to be made money in that particular area? Demographics, the elderly patient. You know, we're all getting older. Joe may be getting a little older faster than some of us with his glasses. But in essence, how are we, as we age, going to want our drugs delivered? Is it going to be in the traditional method? Is it going to be that as we get a little bit older, we're a little bit more comfortable with social media aspects, and we're a little bit more comfortable with the internet, and we're going to have more mail order, potentially? For those that have been around long enough, they'll remember the Norman Paul days and MediTrust and the first shot at mail order that wasn't necessarily successful. Well, you go in and you talk to some of the retailers, they are starting to relook at that and look at saying, can we get people that are on chronic meds into mail order? And so is there ways of getting into more mail order? Are these folks going to want to have their drugs delivered at a kiosk? Don't know. These are questions that will change. And also, if you go to the other side and look at our kids that are growing up, that want things right now. They don't want to wait. They don't want to come back in 10 minutes and it'll be ready for you. They want to push a button and out comes the button from a vending machine, their prescription. That's what they're looking at. So we've got two ends of the spectrum. We've got elderly patients wanting their drugs delivered one way, and you've got the young population moving forward and they want their drugs in a different way. So we have technology that will drive it. We do have technology that will make a change in how we deliver. We have access. People are looking for 24/7, 365, regardless of the day, that want their delivery, be it rural, be it in the city, be it home delivery. I looked at, you hear news now with doctors going back and doing, care at someone's home. Is this something that's going to happen? You can have pharmacists actually delivering medicines and doing counseling at some patient's home or at a nursing home, potentially. And scope of practice is also going to change with regards to what are the pharmacists going to be able to do, pharmacy techs, nurses, nurse practitioners. People are going to get different prescribing, and this is going to change the economics in the retail and distribution area. And I've got in there unipack dosing. Can I move my slides now? Perfect. So in essence, will these trends cause a change in the model? So I talked to the traditional model. The current model is the manufacturer sends it to the distributor or the chain, who sends it to the pharmacy, and the patient gets it. That's a model we've all been very comfortable with, and it's been going on for years. My forecast is for a future model that will have a manufacturer that may look to get right directly to the patient, depending upon their product lineup, and looking at saying, how do I get my drugs right into the hands of the patient? And that's happening a little bit now. Will that continue to happen, and will it happen more vigorously, and will it happen in conjunction with the distributors, in conjunction with the chains? Probably more likely that way as a first step. But the distributors and the chains are looking at getting right to the patient in a more direct manner rather than right from their pharmacy. So they're actually looking at methodologies on actually getting patients the drug delivery much quicker. So they're looking at things like speed. They're looking at things like accuracy and using technologies. And they're also looking at, from a cost perspective, how do we remove inefficiencies from the system? And so I want to throw out the challenge with regards to us as a group of industry colleagues that look at what is our future role in distribution of pharma products. In the past, it's been we send 1 order, 2 orders a week to McKesson, to K&F, to Matrix, to others in the system. And then we basically do a little bit of this. We track it through IMS. We look at our scripts and see how things are moving. Long gone are those days. I think we need to be, as an industry, much more actively involved in going out and seeing our retail partners, understanding what their needs and challenges are, figuring out what programs that we can put in place to work with them, to look at how do we make the system more efficient, and to look at how do we get more actively involved in this system, because we're either going to be in this area a passenger and have the changes impact us, or we're going to look at impacting the changes in a way that makes it more profitable and more beneficial to the patient. So I'll end on that note and pass it over to Kevin. Thanks for your thoughts.